Hello, I'm Dr. Chang Amber Liu. I'm a pediatric anesthesiologist and director of Pediatric Regional Anesthesia. Since 2017, we have been performing spinal anesthesia as an alternative to general anesthesia for infants receiving surgery below the waist. Spinal anesthesia is different from general anesthesia in that it does not require systemic medications and airway instrumentation. Numbing medication is injected locally, which allows surgery to proceed. We've observed that most children fall asleep on their own due to loss of sensory feedback from the body shortly after the spinal medication is injected. They wake up after the numbing medication recedes as the surgery ends and can feed and be discharged home quickly. Our team has used spinal anesthesia for a wide variety of surgical procedures, including more complex urologic surgeries lasting up to 3 hours.
Hello, I'm Dr. Jack Elder. I'm Chief of Pediatric Urology. When I describe the need for surgical correction, many families ask whether the surgery is done under local anesthesia. They know that newborn circumcision is done under local anesthesia and wonder whether this same type of anesthesia can be done for surgical procedures on the genitalia. Many or most families are more concerned about general anesthesia than the surgical procedure itself. The standard in the country is general anesthesia with some form of intubation. They often receive narcotics. General anesthesia is very safe. At Mass General and in many institutions in the United States, some very young babies undergoing inguinal hernia repair have it done under spinal anesthesia, in which the baby is not intubated. 3 years ago, I learned that our pediatric anesthesiologist had been doing some hernia repairs with spinal, and I requested spinal for a few of my patients. The procedures went so well that I suggested that we try it in my other cases.
When you arrive at the hospital, a numbing cream will be placed on your child's lower back. When it comes time for surgery, your child will be brought into the operating room. The spinal anesthetic will be placed so that your child temporarily can't move their legs or feel any pain below their belly button. Then, after all of the necessary preparations have taken place, the room lights will be dimmed and the surgery will begin. Compared to general anesthesia, spinal anesthesia does not require intubation and avoids the use of opioid medications during the surgery. Most infants will fall asleep during the surgery, but for those that stay awake, our team will keep them entertained. Once the surgery is over, you'll be reunited with your child in the recovery area. Because spinal anesthesia avoids systemic sedatives, you'll be able to feed your child shortly following. Soon after, your child will be ready for discharge.
Our successful spinal program was built with great communication and collaboration from the anesthesia, surgical, and perioperative nursing teams. For more information, please refer to our website below. Thank you for listening.